Good evening, folks. I've got discussion D for you. We're discussing 5 ways COVID 19 forever changed how Americans plan for long term care. Okay, so that is D for you. We're discussing how COVID 19 shaped long term care forever. Okay, Key takeaways. Increased awareness of long term care risks. COVID 19 exposed vulnerabilities in nursing homes, making families more cautious about institutional care. The trauma of being locked out from loved ones during outbreaks led to revelations revelation of care preferences, shift toward aging in place. Folks, this is when people decided to have people come into their homes instead of going to nursing homes. Okay, this is what COVID-19 started, was a shift in home care from nursing home care to in-home based care. More Americans now prefer to remain in their homes rather than move to care facilities. This trend is supported by a rise in demand for home care services and remote health monitoring. Greater emphasis on advanced planning. The pandemic prompted people to create clearer medical directives and end of life plans. Families are more proactive about discussing future care needs and legal arrangements, folks. Technology integration in care. Telehealth and smart home technologies gain traction as tools for supporting aging in place. These innovations are now seen as essential components of long term care strategies, policies, and systematic shifts. The crisis accelerated policy discussions around funding and reforming long term care systems. There's a growing interest in alternative models that prioritize autonomy and safety. Would you like to explore how these shifts intersect with frailty aware or memory friendly care models? Folks, on the other side of that, it's all well and good to get somebody out of a nursing home because they wish to age in place or go to their own apartment or house. But you have to make sure that there are things set up for them, like ramps, like home modifications. Bathrooms need to be enlarged, or if they have the right equipment or medication to go home on. When someone leaves a facility, you have to make sure that they have their medications all tied up to go to pharmacy, near their house, so it's easy for them to get to. things of that line. Okay, so just wanted to throw that in. There's a growing interest in alternative models that prioritize autonomy and safety. Would you like to explore how these shifts intersect with frailty aware or memory friendly care models? The trend outlined in the article have significant implications for elder care, particularly in how care is uh, conceptualized, delivered, and integrated into daily life. Here's how each trend reshapes the landscape. Aging in place becomes the norm. Impact. There's a growing preference for staying at home rather than entering institutional settings. Im- Implications. Increased demand for home modifications, e.g., memory friendly design, fall prevention. Okay, like I said, when an elderly person goes to a apartment building or their own house, for that matter of fact, you have to make sure that modifications are done, that that they can be comfortable in their own home, and that their services are running right. You as a transition person, like I was, you have to make sure things are tied in a neat little package before you let your client go for see how they fly with their own care at home. People like me used to come in, um, and see folks like that for like months, and then gradually help them transition to an apartment building with attendant care. But again, you have to make sure that runs right. So what happens is they see you for maybe a month after they get out to make sure that things are okay for them, and then you have to let them figure out how to use their attendant care, and how to tell the person that's working for them what they need specifically, because like I said, everybody's different. Okay, so aging in place becomes the norm. There's a growing preference for staying at home rather than entering institutional settings. Implication: increased demand for home modifications, memory friendly design, fall prevention. Expansion of in-home services like occupational therapy, remote monitoring, and caregiving support. Greater emphasis on autonomy and personalized environments. Advanced planning gains urgency. Impact: families are more proactive about medical directives and legal arrangements. Implications: enhanced shared decision making frameworks, more culturally responsive and ethically grounded care planning. better alignment between care preferences and actual delivery, especially in frailty aware models. Technology integration accelerates. Impact telehealth, smart devices, and remote monitoring are now central to care. Implications, opportunities to embed therapeutic interventions like e.g. CBT, dance therapy, and the smart housing, use of predictive algorithms in early detection of cognitive decline or frailty, ethical challenges around privacy, consent, and data use in elder care. Institutional care faces scrutiny. Impact, COVID-19 revealed systematic weaknesses in nursing homes. Implication Implications, push for reform in facilities or facility design, staffing, and infections control. Greater interest in hybrid models like adult day programs or co-housing. Okay, need for trauma informed care approaches for residents and families. Policy and systematic reform gains momentum. Impact, long-term care funding and delivery models are under review. Implications, potential for more inclusive, equity focused policies. Support for underserved populations like homebound seniors. Integration of environmental health interventions into care frameworks. Okay, would you like to co-design a care model that integrates these trends in with memory friendly and frailty aware principles? We could sketch out a framework tailored to homebound seniors or aging in place scenarios. Okay, next page, folks. Technology is transforming elder care by enhancing autonomy, safety, and personalization, drawing from the document and broader trends. Here's how. Smart housing remote monitoring benefits. Enables aging in place with features like fall detection, medication reminders, and emergency alerts. Supports memory-friendly housing design with adaptive lighting, voice-activated systems, and cognitive cues. Applications, integration of therapeutic interventions, CBT and dance therapies. Into daily routines via smart devices. Use of senior of sensor and wearables to track health matrix and detect early signs of frailty or cognitive decline. Telehealth and virtual care benefits reduces barriers to accessing care, especially for homebound seniors, facilitates regular check-ins, mental health support, and chronic disease management. Remote applications, remote consultations with occupational therapists, geriatricians, and neurologists. Vital caregiver training and support groups. Okay, 3 predictive algorithms and AI benefits. Anticipates health risks and behavioral changes before they escalate. Personalized care plans based on real-time data and historical trends. Applications. Early detection of dementia, depression, or mobility decline. Tailored intervention based on lifestyle, environment, and medical history. Ethical and privacy considerations, challenges. Balancing surveillance with dignity and autonomy, ensuring informed consent and data protection. Solutions, transparent data governance frameworks, and culturally responsive tech design that respects individual preferences. Would you like to explore a tech enhanced care model tailored to frailty aware or memory friendly environments? We could map out how different technologies align with specific needs and ethical priorities. Implementing technology in elder care offers transforming potential, but it also presents several challenges that must be carefully addressed based on the document and broader text. Here are the key hurdles. Okay, guys. Privacy and ethical concerns. Challenge: balancing surveillance with dignity and autonomy. Details: continuous monitoring via sensors or wearables may feel intrusive. Data collection raises concerns about consent, ownership, and misuse. Mitigation: transparent data governance frameworks, culturally responsive tech design that respects individuals' preferences. Digital literacy and accessibility challenge. Many older adults may struggle with using new technologies. Details: interfaces may be too complex or not adapted for cognitive or sensory impairments. Lack of training or support can lead to underutilization. Simplified, intuitive design, ongoing education, and caregiver assisted onboarding, integration with existing care models, challenge, fragmented systems, and resistance to change. Details, difficulty aligning tech tools with traditional workflows in healthcare and social services, limited interoperability between platforms, mitigation, co designed solutions with clinicians, caregivers, and older adults. Standardized protocols for data sharing and care coordination. Cost and equity barriers. Challenge, high cost can exclude underserved populations. Details, smart devices, wearables, and telehealth platforms may be unavoidable for low income seniors. Rural areas may lack broadband infrastructure. Mitigation, public private partnerships to subsidize access. Policy reforms to include tech in long term care funding models. Reliability and safety. Challenge, depends on technology, introduces new risks. Details, device multifunctions or connectivity issues can disrupt care. Over surveillance may reduce human interaction and emotional support. Mitigation, redundant systems and human oversight. Hybrid models that blend tech with compassionate care. Would you like to explore a framework that balances these challenges with the benefits, perhaps tailored to frailty aware or memory friendly environments? We could sketch out a roadmap for ethical and inclusive tech adoption in elder care. Technology offers a wide array of benefits in elder care, especially when thoughtfully integrated into frailty aware and memory friendly environments. Drawing from the document and broader context here are the key advantages. Advanced safety and autonomy. Smart sensors detect falls, wandering, or emergencies in real time. Wearables monitor vital signs and alert caregivers to health changes. Voice activated systems empower seniors to control their environment independently. Supporting support for aging in place enables older adults to remain in familiar, personalized environments, reduces reliance on institutional care, which became a concern during COVID-19. Facility facilities integration of therapeutic routines, mindfulness, dance therapy into daily life. One more page, guys. Improve access to care. Telehealth connects seniors to healthcare providers without travel. Remote consultations support chronic disease management and mental health care. Virtual caregiving training enhances support networks and care quality. Early detection and personalized interventions. Protective algorithms identify early signs of cognitive decline or frailty. Data driven insights allow for tailored care plans and proactive interventions. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. Have a good evening. See you tomorrow for shows.